So there's slight improvement on what has been previously, but we are definitely very far from what an ideal situation would be. I have seen that there are some medical supplies, especially non-pharmaceutical. I mean, previously we had issues of even buying gloves and gauzes and needles and syringes and such. But I have talked to the medical superintendent, and he has confirmed to me, and I've seen that he has those supplies and in good quantities. So there is some slight improvement on what has been or what was during the campaigns. So I give credit where it is due, but we still have a long way to go. And we will ask the people in charge of budget, and I know there's a health committee budget headed by Gino Diva. When they are budgeting for the money, they make sure that there is enough money that is allocated to this hospital. What I would say is that without coming to specifics of Gatundu Hospital, we have a long way to go in addressing issues of health as a country. Because if you think about it, you will not keep a patient here for a year because they're unable to pay their bills. So that's why you find issues of waiver and such. Although there's such a rigorous vetting to know who can be, who qualifies for a waiver and who doesn't. There was an arrangement between the previous county regime and KU hospital, and actually the medical personnel that is here is mainly from seconded from KU. And that is why, I mean, like the MOs, the KU forwarded 14 MOs, and the 4 MOs that were here were transferred to other places. I think there were about 20 doctors, and I think there's a surgeon, and you know, and there are several consultants, maybe about 7 to 9 or thereabout. So that means for a hospital of this caliber, and for a hospital that is treating the numbers that I have seen here, we need serious increase of personnel. I know I found a doctor, a surgeon at the ground floor, and he was overwhelmed. He had seen 99 patients today. To examine them and find whether they qualify to go to well, some of them had been seen by his team. Him and his team had seen 99 people. You know, that is such a huge number to deal with. I mean, you also wonder whether they're able to get quality time with the patient and understand their issues. And when I talk to them, you understand that there will be those challenges. So we're also asking for staffing of this hospital. And the government of Wamatangi has a challenge here. We challenge them to make sure that we have personnel. If they could double what we have, we would really appreciate, so that we're able to reach our patients and reach them and treat them with dignity.
Listening to our people. The best thing you can be able to save yourself medically in this country is by getting an NHIF card. Because with an NHIF card, then we reduce all these stresses. The one thing I would just want to say is that the issue was not as blown out of proportion. But again, it is being, I remember there's a time I talked about mental health. And I said when people are depressed, then they have a problem. Because the economic problem in this country is what is driving this lady to complaining. Because some antibiotics she has to buy, some medicines they have to buy, the patients here are buying. And so it's also a request to our governor, just as he has promised. I think the issue of medical and the issue of hospitals, and especially Gatundu Hospital, is an urgent issue that needs to be addressed sooner than later, because it's a big issue. It becomes septic. There is a way the doctors will try to do it. They may not really explain to you what they are doing, but they will try and do what is within their reach. But you see, as I had said earlier, we are going very bad economic hardships in this country. Then you come to a hospital, you find a doctor who is supposed to attend you, a doctor who has no facilities to attend you. So everybody now becomes annoyed. The patient is annoyed, the guardian is annoyed, and the doctors are also annoyed.
I have to say that an impolite encounter with a healthcare worker is a very unfortunate thing. And once it happens, it doesn't matter the quality of care that you have received in any facility, whether public or private. And it's something that we are grappling with. And what I'm encouraging the public is not to go home with a complaint of that so and so talked badly to me. I would wish that we support each other to help us to grow and to also assist our staff. And the only way we can do this, kindly report any incidents where you feel that a staff did not talk to you properly, so that we can handle it and we help our people to grow in a way that they can be responsive to the needs of our community in a respectful manner.
No riu procedure ya nginya no muhaka kingi acokerirwo ringi na githambio ringi riu maundu macio magake muhe thina muno undu uri ungi urahe nyina thina muno ni horo wa dawa imwe kwaga na ucio ni rugano rwaritio muno thibitari-ini cia Kiambu na ni turaiguire governor akiuga wira ucio wi moko-ini make na ni arageria oni uri kuhota gwika riu koguo dawa imwe iria thitari kuo thibitari nicio mundu arakirwo ni egwithi gukigura riu ara complain muno tondu no ya ndora makome mandagitari ti andu matinda makiheana ndeto itari ndagitari akwire gutire antibiotics aga gutire ki riu gwiciria ni andu kwaga that information na no etiwira wa ndagitari gugutariria ati guku kwana guku gutana ni nundu wa mathina macio ri andu ni arakaru muno guku andu maingirite andu arakaru muno thi no riu nake ndagitari ri nake ni araririra governor itikira to no health ni adivovirwo governor nawe ukoturore nigetha na ithuire twote kunina mathina maya no hari andu matuika mandagitari matire tunua tatu twatetia ati akiuga gwathire riu ndagitari rimwe ni mararemwo kuguo no nyende kuga na kiugo kimwe kwina ruo ruingi muno thibitari-ini na riu njari ona guku ino ya Gatundu mandagitari ni marageria no facilities iria mangibatara cia gukinyaniria uria mangienda guthondeka arwaru makaga na to he thina umwe ndathoma na wandu aitu menaguo ni gutangathitwo muno na gukerwo muno andu moe kandi ya NHIF na ni ciringi 500 no taru wodi otuma na yurite arwaru na ina andu marugamite ku andu acio othe matura matire kandi ya NHIF ni kuguo na ndagitari akenda guguteithia rimwe ni ararigwe guguteithia atia tondu andu ni marabatara mamenyithio wega ati riria wariha kandi ya NHIF kandi yo ni coka ekahota ukurugamira maundu-ini maingi na rimwe ona ndawa icio cikwagaga ringi ona citingiagire riu kuguo ni tukwenda andu aitu ni mabururi wina thina gutire mundu utarona no ni wega riu tuwe ugima witu wa mwiri o uria turiaga irio
ni wega kwaria uhoro wa ma madagitari maria meguku ni twaria na ni marakigeria uguo but kuri ona challenges gutire dawa menacio na no ti dawa cikinyete tondu no ndiraigua kwina andu marathi kugura dawa kuria kambi woria okero agoni painkillers mena brufen kwina andu matanginywa brufen ndingi mena acidity koguo no nginya megubatara dawa ingi cia ruo itari as acidic ta nyamu yo gwitwo brufen koguo icio ndiraigua ni marathi kugura na maundu mangĩ no tariu ndakora maundu maria twarari namo ma gloves ndona na ndonio kwina gloves cia kuigana kwina nyamu iria etagwo gozi iria cia guthie thieta na maundu maria mangi koguo njuge hena improvement on uria kurahanaga mieri 3 mithiru no turi haraihu tutire turakinya ha kuga ati riu thibitari yo ni twikite ndogamu pio infrastructure ikire kuo no ha uhoro wa supplies indo iria twitaga dawa na non pharmaceutical supplies itiri rakinya kiwango kiria tungienda matura-ini na thibitari teno ya Gatundu tondu ni kwa andu ingi mokaga governor na ni junior akoretwo akigeria na ni arari guku kaira gatari atathiete muno ni ariga gukurwe guku na ni junior athiurukire guku ri atindire muthenya mugima togu twatinda na ni amenyire mathina maria meku o togu twamamenya na tondu niwe wina budget na niwe wina function iyo ya thibitari ni ngumuria ame prioritize kana amehe kanya kana ihenya ka mbere nigetha akorwo agitungatira andu tondu maundu maria ndona guku thibitari ino ina andu 300 makomete koguo governor kiru kiria ekwendweke budget yake agithondeka no nginya amikire health kana ugima wa mwiri awikirire muno makiria nigetha ambe athondeke uhoro na thibitari ino ya Gatundu ni tungatagira andu akundu kuingi to andu aguku Gatundu tungatagira andu a Gatundu North ni tungatagira andu a Juja ni tungatagira andu a Thika andu a Githunguri andu a Ruiru kuna andu ingi muno meguku maumite matura-ini mau koguo generally ino ni thibitari iratungatira andu a Kiambu yothe na ona angi maumite kure haraihu ta nginya Nairobi magoka kundu guku koguo ni ekwenda amihe kipaumbele nigetha ihote utungatira andu aguku na ningi andu aria meguku ona magikienda madagitari Wabere ni kwenda mongerere tondu ni gwaragia na ndagitari akanjira kwina medical superintendents gwiciria 18 ale 18 ale momire KU na akinjira uguo namba ciao andu ale meku medical officers na kuguo amatangi angihota kuongerera arigitani no eke wega na ahota kuongerera dawa na indo cia thibitari iria twitaga medical supplies non pharmaceutical medical supplies.
Ni turerutaniria ndagikeno na county ni ratuteithia na ni tukugia na PR training for our staff nigetha andu mahote kumenyerera miario ya maundu maria marathi na mbere kwira andu na ni njui kahinda gatathiete kuraya he maundu megukorwo macenjetie na andu moka to wira tu rirutagwo mwega no ni nginya uria uragutungata gakorwo ni arakuhe ciugo cina muoyo.
Oh, hanini tu.
Semestre, não. É,